remiss in thanking Vicki Stockton and Gloria Broadbent, who have been our language interpreters who have been with us all along here. So I want to thank them for their service and their willingness to be here with us each time. To get into the numbers for today's briefing, we have 4 lab-reported confirmed positive cases since our last briefing yesterday, which brings the total of in Oneida County of positive cases to the number of 28. Out of the 28 cases, 1 remains admitted outside of Oneida County. There are 5 patients that are currently hospitalized in Oneida County from this group, of which 4 are in the Mohawk Valley Health System's hospitals and 1 is in Rome Hospital. Those new patients are being interviewed, and case contacts are being investigated as we continue. We did receive word on another 12 lab-reported negative cases from yesterday, which brings that total up to 276. There are currently the numbers tested in Oneida County is at 506. We have approximately 230 people in mandatory quarantine, along with 204 in precautionary quarantine. And the total that have been discharged from both of those categories since the beginning of this event is 427 in terms of that. I just want to clarify and go through a couple things after the numbers that I gave. Yesterday, at yesterday's press briefing, we were asked about a case that occurred, was reported by the Masonic Care community regarding one of their employees. We had not known about it at the time of the briefing, and the reason we had not known is that that individual that case was a case identified as a Herkimer County resident, and it was not the Oneida County Health Department that was notified, but rather the Herkimer County Health Department, because the individual was from and resides in Herkimer County. I would urge, based on that, any employer, that is informed of a positive case or case contact in this regard, should really coordinate with whatever county it may be, but in this case, obviously, or in our case, for Oneida County, our health department, our office, in terms of communication, because what happens is what I've talked about: when information is not properly controlled and vetted, confusion can arise, especially with this situation, which makes it very hard for us to maintain the level of contacts that we're doing, and creates a little bit of confusion throughout the system. That's how difficult it is, and we understand that for everybody. But that's why information has to come from one source at a time, and we ask that wherever we can help do that, we will. So if employers are contacted, please reach out and contact us. Again, I'm going to reiterate, especially we've seen it more and more as the weather has been getting better. People are still congregating outdoors as well. It's still a problem when you have large groups. It really has to stop. People are still doing it. The weekend is upon us, and even with just as the weather is going to get better in the spring, and hopefully things will get better, but they won't if we don't stop congregating and gathering in various areas. The cities, both of the cities, and I know the towns have closed parks except for walking, which there should be 6 feet of distance between people as they maintain their walks and go through that. But the congregating in parks and in different areas and in different settings really is not It's not what we should be doing. And again, the same thing as far as gathering at homes of neighbors or friends or family really needs to be stopped. You see as our cases are increasing over the last few days. I'd like to also mention another part of the virus. While people are cleaning and sanitizing, and Phyllis has instructed people at various times of what they should be doing, and not just personal hygiene, washing your hands, not touching your face, doing all of the different things, and maintaining that good hygiene in the home, especially in your bathrooms and the like. Clearly, a lot of wipes are being used, the Clorox wipes and the various wipes that are sanitary in terms of cleaning around the house and cleaning various items. Problem is, it's now beginning to impact our sewer system because people are flushing those wipes, and that is a problem because it is causing us problems in our sewer system. We're going to put some more information out on this week. Please, throw them out. Put them in the garbage. Put them in the trash, in the bags. Flushing them creates other problems, which can be as well a sanitary problem in the long run if things start getting backed up. And to our sewer or water treatment facility, it will cause us problems, and it will cause other issues relative to that. So we are getting impacted by that on a daily basis. Please don't flush those wipes as best you can. The governor had several updates that I just go over briefly. The presidential primary has been moved to June 23rd, which will also include any other primaries if they are any other primaries if those were scheduled to take place in April. Tax day is also along with the federal tax day that was changed to July 15th. It's also the state tax day is also July 15th. The issue of more hospital beds is being addressed in the city, with the Javits Center opening more beds on Monday, and 3 more New York City sites are being put together. Again, for those people who have been tested, please do not call about your results. You'll be notified as soon as they are available. Don't call 911 or ambulance services about symptoms or about testing requests. Please contact your health care provider. Again, we are reiterating where testing is still being done for those patients who absolutely have the conditions that warrant it, and starting with the hospitalized patients, and there are people in the hospital that also are emitting symptoms as well, and as well as the people that are at home, and those are priorities first, and then other symptomatic individuals, obviously the elderly, the chronic, those with chronic medical conditions, healthcare workers, etc. Low-risk patients should self-isolate, but always contact your healthcare provider. I continue to urge all of us to support local businesses where we can. There are several local businesses, and many local businesses that are still operating, and whether restaurants or different services. Please support them the best you can during this crisis, because they need it. They need the assistance. We want to keep this economy going and keep as many people working as we can. If you do believe an employer is in violation of labor laws or the issues put in place on the executive order by the governor, contact the New York State Attorney General's office at 212-416-8700 or labor.bureau@ag.ny.gov. I mentioned about congregating. Do not congregate. Stay at home. Stop the spread. Don't have visitors there. Remember, visiting elderly should be on a limited basis. For young people, there was an interesting column today that talked about how young people are conscious of all of the things that, health-wise. in terms of what they've been doing over the years, but this one they seem to either ignore or disregard. The warnings are real. If you don't get it, you could still spread it to anyone in your family, friends, especially the elderly, and clearly you really need to separate and not congregate the way you have been. Continue to practice the proper hygiene, as I said, and be patient as you go into the grocery stores for any type of products. There's no need to hoard them. People are, the stores are restocking on a daily basis, but hopefully that should be settling down. There's no need to do that, and please be patient with one another. The Oneida County Mental Health Hotline started yesterday and will resume on Monday morning at 8:30 a.m. To 6 p.m. Monday through Friday. That number is 1-800-678-0888. The helpline for daycare, emergency assistance, and aging and chronic care issues is 315-798-5439. That is available from 8:30 a.m. to 6 p.m. The Oneida County COVID info hotline is available 315-798-5431 from 8:30 a.m. to 4 p.m. From on Monday to Fridays, and 10 a.m. to 4 p.m. on the weekends. Again, that's the Oneida County COVID-19 info hotline, which goes to our county health department. The volunteer email address is still listed and on our website as well, volunteer@ocgov.net. We have been mobilizing volunteers the last few days in different areas of the food pantries and distribution and some other deliveries that are taking place. And we are still taking any names of people that want to volunteer. We still need volunteers, as this gets more and more in depth over the next several weeks. Remember the COVID-19, the Mohawk Valley COVID-19 Response Fund, which has been established by the Community Foundation of Herkimer and Oneida Counties and the United Way of the Valley and Greater Utica area, which is mvcovidfund.com. That fund has over $500,000 right now as we speak, and that will be made available for people in need. And we know that things are, that people will need that assistance going forward. Visit our website, ocgov.net, for information on COVID-19 and the contact numbers that I've given you today as well. It archives all of these daily briefings for you as well. There are informational videos regarding public health, this virus, and what you should be doing. There's mental health in terms of those for everyone who has either issues or questions, anxiety, or concerns about the virus, as well as our Youth Bureau and recreation for our children, and as well as adults in terms of recreational activities. And we will be doing more videos over the next week. They also have we'll link to our sheriff's office, the senior hours for shopping at local businesses, and the sheriff's office also has its Home Alone Kids checklist on there. So I think that we've covered what we have for today, and with that, I will have Phil open up the phone lines.
All right, so first up today, we'll have Brent Carney from WKTV.
Hi, so I was just wondering, how concerned are you guys with the positive case in Masonic Care, and are you learning anything new about what they're doing to prevent it from spreading?
You want him? I'm going to let Phyllis take that one.
Yeah, Masonic Care Community or any other congregate facility that has patients, there's a variety of different types of places like that could potentially have employees that become positive, as well as our healthcare facilities. All of those staff from those facilities are communicating with our nursing staff on a regular basis, identifying anybody that was in contact with the employee, going through their line list of who they have to monitor, and those people will obviously be out of work for the quarantine period, as well as monitoring whatever patients in those facilities that were treated by that staff person or any staff person. So there's a whole process that happens when something like this occurs, and it also happens for other illnesses as well, like whether the flu or any types of communicable disease in any kind of residential facility. So we are working with them, and we will work with anyone else that has a case to determine patients and exposures.
And then Phyllis, we're hearing a lot about this antibody test. Could you go into a little bit more detail about what that means and what that could mean for the future?
Yeah, I don't really have any. I haven't really researched it at all. I know that they're talking about that, and I think it's a matter of, in the future, who is most likely to be affected by the virus and how it could be treated in the future. But I'm sorry, I don't have any details for you today.
Okay.
Sorry.
And then, I don't know if you or the county executive can answer this next one. Is there any further discussion about bringing downstate patients upstate? Have you heard any new information about that?
No, we have not been notified, and I'm sure neither of our facilities have been notified that any patients are being transported at this time.
Okay. That's all I have for now.
Just to go along with that, Brett, the mention or the piece I mentioned regarding the Javits Center being established as a hospital, and then looking for other pieces of or other parts of New York City. I know the governor said yesterday he wants to see another facilities established in each of the 5 boroughs, and then in Westchester and Nassau and Suffolk. So again, I think that you'll see, as that happens, that'll alleviate the strain down there. But we have not heard anything. I'll just echo what Phyllis said. We have not heard, nor has there been any discussion other than preparation.
Okay. Thank you.
Yep. Thank you.
Next, Jen Seelig, WUTR.
Thanks, Phil. Do we have any cases of positives from earlier on who recovered fully to the point of being released from quarantine?
We do. Yes, we do. Yes, we do. And when you look at those the number out of quarantine, which was 427, and remember, usually it's that 14-day period too, and just keeping in mind that while we've seen in the last, and we do have some hospitalized patients, that the majority of the cases in Oneida County to date were not hospitalized and were and either are or were at home recovering.
Okay, and from the 4 who were hospitalized yesterday, from my understanding, there's an additional patient now bringing 5 to the county. But is there any updates on their status? The 4 from yesterday to today.
Yeah, we do have patients still in the hospital, and we're communicating as we speak today to the hospitals, and they're all still remain in their same condition in their same facilities, and as they change, they'll be giving us some additional information. But at this point, we don't have any definite changes in conditions for any of our hospitalized patients.
Okay, and my final question is, going back to the employee at the Masonic Care Community, doesn't that facility sit in Herkimer County? So Oneida County Health Department won't. This is all for Herkimer County Health Department?
No, actually, the cases go by the patient's residence address. So if the case is the person that's tested positive, it goes by their home address, and then that county monitors and takes that case as their own. So it would depend on the person's personal home address. Make sense?
Yeah.
Yeah.
Okay. Thank you. That's all.
Jen, just to clarify, the Masonic Care community sits in Oneida County. The facility itself is in Oneida County.
Okay, thanks, Jim. Next, we have Rob Booth from the Observer Dispatch.
Can you hear me okay?
Yes. Yes, Rob. Go ahead.
First question pertaining to earlier today. President Trump had mentioned about a possible short-term quarantine for New York, New Jersey, and parts of Connecticut. Cuomo responded after that saying they didn't discuss that at all when he talked to him. I was just wondering, A, have you heard anything about this, and what exactly would a quarantine mean if it were put into place, say, in Oneida County?
Well, again, not knowing what they talked about, I thought the president specifically talked about New York City, and maybe even broader. I thought his points were more about the city because of the number of cases as well as the governor. I mean, a quarantine for an area, I know, in terms of something would be really very restrictive in terms of the amount of movement. It's really hard. I mean, it's very hard to enforce. It's very hard to engage, but that would involve really restricting all kinds of travel from one area to the next, which is very hard to do with the number of access points. So I'm not sure what the president had in mind, and I know the governor has talked about it. I know that during 9/11, again, for a time, New York was under that quarantine in which the city only allowed vehicles in that were essential, bringing in medical supplies, essential services in that regard, really essential food, and the things that kept that were ultimately necessary, but no other unnecessary movement. That's all I got. I really think it'd be very difficult then to quarantine an entire state. Then you pretty much have to shut down any of the activities that are taking place, but public safety and public health would still need to be functional. So it's kind of not it's not as easy. It's a lot easier said than done.
Okay, thank you. I have one other question. I'm not sure if this would be for you or for Phyllis, but about the 40,000 plus healthcare workers who have signed up to volunteer. Is there any way that we have local numbers of how many of those came from Oneida County?
I don't right now. I know that through our with the hospital systems and the like, and even on our volunteers, I don't have a specific number on healthcare right now.
Okay, if I could sneak one more in, I just wonder what the status of drive-through testing is for our county.
Well, right now we stopped that over a week ago, or just in this past week. As the hospitals are dealing with the criteria that we established a little over a week ago as well, in terms of that, to limit it to the actual testing in the hospitals. Right now, that seems to be working in terms of the numbers that we've seen, but obviously that's something that we continue to discuss each and every day, depending on whether or not it's going to be needed if we see a surge or the apex that the governor and other health officials refer to. So it's something that we've got, I guess you could say, in standby mode if necessary to reinstate. But right now, there's no immediate plans for that in the next couple of days.
Okay, thank you.
Thank you.
Okay, thanks, Rob. Next, Rocco Razuka, talk to the council.
All right, thanks, Phil. I have a few quick questions for Phyllis first.
Okay.
As far as the testing goes, what is the current turnaround in terms of getting test results back at this point? I know that's kind of changed over days. So what's the turnaround, and is there a procedure for essentially first come, first serve in an order, or do the results come back randomly?
turnaround time's varying. It's a couple days depending on the severity and the criticalness of some cases, usually in hospitals, and it depends on the lab. So there's various community labs around the country that are now testing and certified. So they're ranging from a couple days to a few days. The procedure for prioritizing the test, did you mean, or testing someone?
The test results, I guess, prioritizing them, and I think you answered that in terms of perhaps the severity, but essentially, are they coming back in any kind of order, or is it pretty much random based on the severity of the cases?
Yeah, I think we're getting tests just randomly from everywhere. We're getting lab results from providers that have tested, and they're getting the results and calling us and faxing us results. We're getting test results directly on our New York State electronic method of pulling off our test results. We're getting test results from the hospitals who have admitted someone. We talked a little bit about the patient that might be in the hospital for something else, not doing well, and they want to rule out COVID, so they're testing there. So those tests would go directly back to the hospital, and then the hospitals are letting us know. So we're getting them in different types of methods back to us in different time frames. So we're just trying to keep track of everybody that's been tested and where they are and who their contacts are.
Okay. And have you gotten any post-mortem test results back to confirm whether anyone who had died after the fact has been determined that they were positive for COVID?
We have not have any positives, no.
As far as linked to any type of death after the fact?
Right, we do not.
Okay. And for anybody who's maybe being monitored or quarantined at home, if they do become hospitalized, is the procedure for them to pretty much come to the hospital if they feel they need to, or is there any procedure in place that essentially says if you reach this level of severity, we're going to, whether you like it or not, we're picking you up and we're taking you to the hospital?
No, I think, patients, when we talk to them when they become under our quarantine, so to speak, or isolation at their homes, we're talking to them on a daily basis and monitoring their symptoms. And if anyone, what they're taught, from the educational component of what to look for and how they're going to be caring for themselves, to really reach out to their provider as well as us. If their symptoms get worse, they're having difficulty breathing, shortness of breath, or some really severe change in their status, and those people are generally speaking to their provider, who recommends a transport to the hospital facility for admission, and then we'll be notified in that process as well by the sometimes the provider, but definitely by the hospitals and the pre-hospital providers.
Okay. And my last question for you, as far as these 15-minute tests that were approved this past week, is there any talk about having any of those sent up here to be utilized that could potentially result in the mobile test sites being reopened for quicker drive-through or pass-through, I guess?
We haven't received any guidance on any of those tests and where they are or who will be able to use them or anything from New York State Health Department to date.
Okay. And Tony, quickly on you, I appreciate being the chance to ask a few questions here, but Tony, just one for you here.
Sure.
There's been news reports of Harvey Weinstein, who has tested positive coronavirus, passing through Oneida County, one of the prison facilities in Marcy. Were you made aware of that at all in any way, and as far as it might be of a concern to some of the local people who do work in that facility?
Yeah, no, Rock, I've just heard what's been posted around, or in the I don't know if it's rumors. I really have not been told by any authorities on the state level of that. In fact, I even discussed with Sheriff Mayshow yesterday if he was aware of anything, and he was not. As I said before, I know that corrections on a regular basis, not even in this situation of COVID, move different prisoners from different facilities around the state. I mean, they don't notify us then, unless by chance they were going to place them in our facility, which is which is not the case at all in this or anything else that we've seen. So I really can't even comment on that other than we were not told anything, nor was the sheriff of this county. So I really know nothing about it.
Do you believe you should at this point, since there are local residents who do work there?
Well, I think that I believe if they're placing COVID prisoners there, we need to know about that. I will say that much. If they are placing them there, we need to know.
Okay. All right, that's good. Thank you.
Okay, thanks, Rocco. Next, Carly Stone from United Dispatch.
Hi, thank you. My question will probably be better for Phyllis. So even though we still know very little about the virus, I was wondering what are we seeing or what are we assuming about people's ability to become sick from the virus again after they've already recovered from it once?
We haven't seen any patients that have improved and recovered that are having any symptoms in our community at this time. So I don't have any factual statistics or research about that. I think the question you're asking is, if we have the disease, we'll be immune to it for the next time. And I don't know if that research has been completed. If it has, I haven't seen it. I try to think about it sort of like the flu. Next year, when all this passes, will we have a different strain? Will it be the same strain? If we have a vaccine, will that protect us? Whereas now with the flu, you might have a flu A or a flu B. So I think all that research is currently happening, and I'm sorry I don't have the answers for you, but at this moment we haven't seen anyone improve, be better, and then become symptomatic again from COVID.
Okay, thank you. That's all for me.
Thank you.
Okay, thanks, Carly. Next, we have Harrison Grubb from Spectrum.
Hi, my question is, the governor has been making this big push to try to get as many ventilators as possible for the state. I know that there's been estimates that the apex here in the state is anywhere between like 14 and 21 days, and they obviously want to have these supplies for that worst case scenario type situation. I feel like a lot of that is talked about in the New York City area. Has there been talks about trying to get more of those supplies in Oneida County and throughout central New York?
Well, clearly, yes, there has. I know, and speaking with the hospitals yesterday, especially in preparation, but also for what we have and need. Remember, as you deal with this, you still have other patients in the hospital system, any hospital system, whether it's ours or Syracuse or Herkimer or wherever, that need ventilators because of other conditions. So they're being used in all throughout. I know that our hospitals would, especially in view of a possible surge or apex numbers going up, that are looking for additional ventilators. So I think everybody's basis right now is to double what they have, or at least attempt to double what they have. So clearly, upstate is not is not being left out of the request, and it's a matter of getting those up here. So we're requesting just like everybody else. Obviously, the necessity and for what is happening in New York City is a totally different scope of in terms of numbers, but the same with the other materials and supplies that are necessary for this, that for the healthcare professionals, for everybody is being sought by every corner in this state, and in every hospital system. So we are attempting to get what we can for our hospitals as well.
All right, perfect. Thank you.
Okay, thanks, Harrison. Next, Andrew Dominio from WIVXV.
Thank you. First quick question was maybe this is for you, Phyllis. Something you had said earlier. Are you guys made aware of every test that's taken, and how many test results are pending still?
Yes. Andrew, we're aware of every test that's happening. So once someone's tested, they're being monitored by us. So we do know who's tested and then who's contacts of those cases. I'm sorry, you asked about total individuals tested has been 506 to date. Is that what you asked? I'm sorry.
Yeah, I just how many were still pending of people test? How many people are you're awaiting test results on? I guess.
Well, yeah, probably over 200.
Over 200.
Yeah, we have, like, when we talk about total individuals tested, some of those have been on the quarantine, been off. We're still waiting for some, and every day we're getting new ones in. So it's a number that changes constantly that we're waiting for. And, you know, as we get them in the morning, by the afternoon we might have some more results coming in. So we totally tested 506 people. We still have 230 people on mandatory quarantine, so that means those people we're still pending their results. Precautionary potentially could be people that weren't tested and they're just under self-quarantine. Did that help you?
Yes. Okay. And then the condition of the 5 people at the hospital. Do you know what the condition is? Are those people on ventilators? And then with the topic of ventilators, is the hospital equipped to handle the need if it arises?
Yeah, there are all the patients that are in the hospital currently, locally patients. Some of them are on ventilators, some are not. Some are in the intensive care unit, and some are on like a regular floor, regular unit. Hospitals are definitely equipped to care for patients on ventilators, especially in their intensive care units. The question about prepared to handle the influx of needs for ventilators, is that what you mean?
Yes. Do you feel like they have what they need for now, or do you think that could be a concern in the future?
Well, I'm assuming for right now, yes, if they have what they need. Future, when you talk about the increase in numbers that they may need, and I think that's part of their surge plan. I know for their preparedness plans at hospitals, they have to identify how many they currently have, how many they have access to. I also think that, and I know that the hospitals are working with some other local providers in our communities that may not be open for business at this time, that can have ventilators, the machines that can be used for hospital patients if necessary because they're non-essential services are not happening right now. So elective surgeries aren't happening in surgery centers. Some private physician office groups might do surgical procedures in their facilities. So I know that those kinds of conversations are going on between our hospital executive people and our communities, as well as looking for where, as county executive mentioned, where they can get additional ventilators as well.
Okay. And then do you, by any chance, have a number of ventilators at the hospital's disposal?
No, I thought Mrs. Stromstead reported the other day that they had 50 or so, 50 at Mohawk Valley Health System. I don't know the status of Rome's.
Yeah. Okay. Thank you very much.
You're welcome.
Okay, thanks, Andrew. And lastly for today, David Hill, Rome Center.
David?
Oh, David, are you with us still, David? No, you made a drop.
Okay.
Okay. I guess that'll do it for today then, folks. Back to the county executive.
Okay, again, thank you all for joining us again today as we reviewed the status of cases regarding COVID-19 and the other issues that we stressed each and every day regarding this virus and really how we continue to combat it. I want to thank Phyllis for her work today, as well as Vicki and Gloria for being with us. We continue to stress not to congregate where you shouldn't be in terms of groups. Stay away from visitations in other people's homes. It's hard. All of this is hard. All of this is even hard to say, to tell people not to do that. It's a difficult thing for me, and I know for other other leaders to look in the camera and say, do not go to people's houses, do not congregate with your friends and family. But we really need to do this as best we can over the next several days and into the few weeks as we continue to battle this and try to keep the numbers down, stopping the spread, staying the course that we've been on. Very difficult as the weather changes. As I said at the beginning of this broadcast, that people want to do things. We all want to be out there. We all look at the weekend, especially today and tomorrow, as a time when we have the ability to be a little more free and do that. We will get there. We will together be able to enjoy each other's company again and be out and enjoying all of the amenities that we have and get back to some a better sense of normalcy than we've seen over the last few weeks. It's going to take some time, and we have a way to go, as I keep saying, and we'll get there sooner if we follow the directions that all of our healthcare providers have established. And I want to also continue to tell you to really check our website, ocgov.net, for updates and for other informational videos and the other information is such as our helplines and our hotlines and our mental health hotline, all of the things that we've listed and talk about in our daily briefings. You can go to ocgov.net and go to our COVID-19 information and see that. As we wrap up today, tomorrow we are in the weekend, as I said. Tomorrow is Sunday. One of the things that we've talked about each and every day is really is the anxiety and the overload of the information that we get literally every minute of every day on this. So tomorrow, as I've said over the past, there were the weekends for our residents to really take time to relax with your families at home, in your home, families that can take a break from all that is happening. We are not going to have a briefing tomorrow. We want people to relax and take a breather. We will provide updates on our case numbers. We will continue working. Our health department staff, my staff, all of us will continue to work in monitoring this and continue to provide the services that are necessary as we go through this. The helpline or the COVID-19 info line in the health department will be operational tomorrow from 10 to 4. We will continue to provide you with an update on cases. Should anything warrant a press briefing tomorrow, we will hold it, but let's take a Sunday to take a break and really enjoy each other as best we can under the circumstances. Stay safe, stay apart, and 6 feet social distancing as best you can. Take a walk if you can outdoors if the weather cooperates. Put the porch light on to keep that light burning, and we will see you again on Monday unless there's some reason to come and talk to you again tomorrow. But for this time, we'll take a break, and we hope you enjoy the rest of this weekend. Stay safe. Be smart. God bless, and put the porch light on.